Our fascinating brain controls the way we experience the world around us. Imagine you're walking through a fragrant field of freshly bloomed flowers. The scents waft up your nose. The nerve cells in your nose detect these sensations and send signals to your brain, which turn them into what you smell. All in a matter of milliseconds. This is possible thanks to millions of specialized nerve cells called neurons. Neurons communicate with each other by sending impulses along tiny fibers, like electrical wires, from one neuron to the next. And if we take a closer look, we see that they communicate by passing chemical messengers called neurotransmitters. Research shows that the nervous system of people with migraines is more sensitive than that of others. Their nerve cells are easily stimulated, thereby producing more neurotransmitters. As tsunami-like waves of electrical activity spread over the brain, various functions such as vision, sensation, muscle coordination, and speech are temporarily disturbed. It is these disturbances that cause the aura, the symptoms that occur within the hour before the headache. A typical aura occurs in 25% of patients and is characterized by vision changes, such as seeing zigzags or flashing lights. The headache itself starts when the trigeminal nerve is stimulated. This nerve sends pain impulses from the eye's forehead, upper eyelids, mouth and jaw to the brain. This causes the brain to release substances that cause the blood vessels in your brain to swell, which in turn puts pressure on the brain and accounts for the throbbing headache, nausea, vomiting and sensitivity to light and sound. Most migraine headaches last about 4 hours, but severe ones can go on for more than 3 days. Estrogen appears to trigger migraines, possibly explaining why migraines are more common among women. Some women have migraines just before or during their period. Migraines often occur less often and become less severe in the last trimester of pregnancy when estrogen levels are relatively stable. And they worsen after childbirth when estrogen levels decrease rapidly. Some oral contrast are contraindicated in people who have migraines with an aura because of the increased risk of stroke. Other triggers include lack of sleep, stress, red wine, cheese, changes in the weather, flashing lights, and strong odors. When a migraine's trademark throbbing finally lifts, the relief is profound. But for many people stricken with these debilitating headaches, their distress isn't over just yet. Instead, a distinct phase of migraine called the Postdrome leaves them feeling achy, weary, dazed, and confused. And this phase is also called the migraine hangover and is remarkably common, following up to 70% of migraine attacks according to a recent study. Migraines cannot be cured, but they can be controlled. Doctors encourage people to keep a diary. In it, people write down the number and timing of attacks, possible triggers, and their response to treatment. With this information, triggers may be identified and eliminated where possible. For mild to moderate migraines, non-steroidal anti-inflammatory drugs such as ibuprofen can help control the pain. They can be taken as needed during a migraine attack. If ordinary painkillers are not helping, you should make an appointment to see your doctor. They may recommend adding a type of medicine called triptans. Triptans are drugs that can abort migraines and are thought to work by preventing the release of the substance causes your blood vessels to swell. They are most effective when taken as soon as the migraine begins. Finally, if these drugs are not effective enough, your doctor will recommend taking drugs every day to prevent migraine attacks from happening. And there's a lot of evidence to show that they reduce the number of migraine attacks by at least half. Thank you for watching this video. Please watch my next video if you want to know how people die from cancer or how to recognize the symptoms of a dying person.